Our study is a single-arm pilot study on relapsed refractory childhood cancer patients, where we implement a functional precision medicine approach and illustrate the feasibility of guiding treatments in those relapse settings. We enrolled 25 patients representing 12 distinct tumor types, and most importantly, we enrolled both solid tumors and hematological cancers. And what we found was compared to genomic profiling, ex vivo drug testing provided more informative results and more treatment recommendations to patients. And we also found that we were able to return results back to those patients in a clinically actionable time frame, especially those cancers that are progressive. So it's important that we could return results back in a quick turnaround time. And when we looked at and compared clinical outcomes, we found that patients that were guided by FPM, or functional precision medicine, had a significantly improved best overall response and a longer progression-free survival compared to their own previous regimen, and also compared to those patients that were treated by standard of care. Our study is a proof of principle that we need to be able to repurpose FDA-approved drugs that are approved in adults or in other indications, so we could potentially use them in childhood cancers. Because one of the main challenges is in the last 20 years, very few drugs have been approved by the FDA. So functional precision medicine provides the opportunity to repurpose FDA-approved drugs in an off-label indication and provide more options for pediatric cancers. The promising results from our studies basically tells us that we should implement functional precision medicine in large-scale clinical trials. We're now in the process of setting up a CLIA-certified lab for functional drug testing, which will allow us to implement and validate functional precision medicine in large-scale clinical trials.